back to the CyberClinic Podcast. This is episode 20. I am Claude Bernard, a cybersecurity advocate and doctoral candidate in health informatics. Today, we're going to take a journey through the medical world, but not from the top down like most of us imagine. Instead, we're flipping it. We'll start with the unsung heroes you meet first in the clinic or hospital and build our way up through nurses, doctors, specialists, and finally the leaders who shape entire health systems. Along the way, I'll define each role so you'll know exactly who does what, from the receptionist to the chief medical officer. Because healthcare is not one person, it's a team effort, and every role matters. When you first walk into a clinic, the medical receptionist or unit clerk is typically your first point of contact. They manage scheduling and records, direct patients to the appropriate locations, and ensure that insurance and paperwork are in order. Without them, the front line of healthcare would be chaos. Then come the medical assistants who take your vital signs and prepare you for the nurse or doctor. They bridge the gap between admin and clinical work, ensuring patients are comfortable and ready for their appointments. Certified nursing assistants, or CNAs, provide direct daily support, helping patients with activities such as bathing, eating, and mobility. Their work is intimate and demanding, but it restores dignity and comfort for patients who can't do these tasks alone. And don't forget the phlebotomist, the steady hands who draw blood for tests. They make one of the most common procedures in medicine quick, safe, and accurate, often calming nervous patients in the process. This is the foundation. Without them, the system stalls before it even begins. Next up are the licensed practical nurses, or LPNs. They give medications, clean wounds, and monitor patient health, often in nursing homes or rehab centers. LPNs provide direct bedside care and are usually the primary point of contact for patients and their families, offering both medical support and emotional comfort. Then the technician, radiology techs, run your x-rays and MRIs. They operate imaging machines safely and ensure clear, accurate images, allowing radiologists and doctors to make the proper diagnosis. Surgical techs prepare the operating room and assist during procedures. They pass instruments to surgeons, maintain sterile fields, and make sure surgeries run smoothly from start to finish. Lab techs analyze blood, urine, and tissue samples. They run tests that reveal infections, chemical imbalances, and even early signs of disease, information that doctors depend on to guide treatment. These roles may not always be visible, but they keep everything precise and reliable. Then we reach the registered nurses, or RNs. They're the backbone of healthcare, assessing patients, administering treatments, and coordinating care across teams. RNs also educate patients and families, act as advocates, and provide continuity in environments where care can feel overwhelming. Among RNs, there's a special group, labor and delivery nurses. They guide mothers through childbirth, closely monitoring both the mother and baby during labor. They're often a steady presence in one of the most intense and emotional moments of a family's life. Alongside nurses are the allied health professionals, respiratory therapists, helping patients breathe. They manage ventilators in ICUs, treat asthma and COPD, and step in during emergencies when airways are compromised. COPD stands for chronic obstructive pulmonary disease. It's a long-term lung disease that makes it hard to breathe because airflow is partly blocked. The two main conditions that make up COPD are chronic bronchitis, characterized by long-term inflammation of the airways, often accompanied by excessive mucus production and coughing. Emphysema, damage to the tiny air sacs, alveoli, in the lungs, which reduces oxygen exchange. Common symptoms include shortness of breath, chronic cough, wheezing, and frequent respiratory infections. The leading cause is smoking, but long-term exposure to air pollution, chemical fumes, or dust can also contribute. While there's no cure, COPD can be managed with inhalers, medications, pulmonary rehab, oxygen therapy, and lifestyle changes to improve quality of life. Physical therapists who restore mobility and strength after injuries, surgeries, or strokes. They develop exercise programs, teach safe movement techniques, and celebrate milestones as patients regain independence. occupational therapists who retrain patients for daily life, whether it's relearning how to button a shirt, cook a meal, or return to work. OTs focus on practical skills that let patients live as fully as possible. Speech language pathologists help people regain communication and swallowing abilities. They work with stroke survivors, children with developmental delays, or anyone struggling to speak, swallow, or process language. Nutritionists and dietitians who design eating plans that support recovery and manage chronic illnesses. They help patients understand how food can be used as medicine, preventing complications and promoting long term health. These roles make recovery whole, not partial, and they often build long lasting relationships with patients on their journey back to health. Next are the advanced practice providers, nurse practitioners, diagnose illnesses, prescribe medications, and often serve as primary care providers. They bring a nursing perspective that emphasizes prevention and holistic care while still managing everything from routine checkups to chronic illnesses. Physician assistants, PAs, are versatile clinicians who work across specialties from emergency care to surgery. They are trained in the medical model and often collaborate closely with doctors, stepping in to provide critical care when physicians aren't immediately available. Together, NPs and PAs expand access, especially in communities short on doctors. They're often the reason patients can be seen quickly, and for many families, they're the most familiar face in healthcare. Now we reach the doctors. Physicians spend years in training and often specialize in a specific area. Primary care doctors, family doctors, and internists are the first point of contact, managing checkups and chronic conditions. They focus on prevention, early detection, and ensuring that patients are referred to the right specialists when needed. Pediatricians specialize in children's health. They monitor growth and development, administer vaccines, and treat a range of conditions from ear infections to childhood asthma. Psychiatrists focus on mental health with medications and therapy. They treat conditions like depression, anxiety, bipolar disorder, and schizophrenia, often coordinating care with psychologists and social workers. Psychologists, by contrast, usually don't prescribe medications but provide therapy, counseling, and testing to support mental well being. They are trained to help patients understand their emotions, behaviors, and thought patterns, offering tools to cope and heal. Cardiologists care for the heart. They diagnose and treat heart disease, manage blood pressure and cholesterol levels, and perform procedures such as stress tests and cardiac catheterizations. Oncologists treat cancer. They guide patients through chemotherapy, radiation, and immunotherapy and coordinate with surgeons in palliative care teams to provide holistic support. Neurologists focus on the brain and nervous system, treating conditions such as strokes, epilepsy, dementia, and multiple sclerosis. They often collaborate with rehabilitation teams to help patients regain function after a neurological injury. Some neurologists become migraine specialists dedicated to treating chronic headaches. They use medications, nerve blocks, and lifestyle approaches to give relief to patients living with disabling migraines. Orthopedic surgeons, often called bone doctors, treat fractures, sports injuries, arthritis, and spinal conditions. They perform surgeries such as knee replacements and spinal fusions, but also collaborate with physical therapists to help restore mobility after injury. Surgeons perform all kinds of operations from emergency appendectomies, organ transplants. They work with teams of nurses and anesthesiologists, and their precision and skill can mean the difference between life and death. Anesthesiologists work with them, ensuring patients are safe, stable, and pain free during surgery. They monitor vital signs every second and also manage pain after surgery or in critical care settings. And while many of these specialists work directly with patients, others play a vital role behind the scenes. That's where the pathologists, physicians who study tissues, blood, and organ under the microscope to make diagnoses. If you've ever had a biopsy to check for cancer, it was a pathologist who confirmed the result. They provide the critical information that guides surgeons, oncologists, and other specialists in making treatment decisions. Supporting them are histotechnologists and histotechnicians. They prepare the tissue sample, cutting them into thin slices, staining them, and mounting them on slides so the pathologist can make an accurate diagnosis. Without their precise work, a pathologist couldn't see the cellular details needed to diagnose diseases accurately. Additionally, we have women's health specialists, including obstetricians, and gynecologists, also known as OB-GYNs. Obstetricians focus on pregnancy and childbirth, ensuring safe deliveries and managing complications. Gynecologists provide care for women's reproductive health across the lifespan, from adolescence through menopause. Working alongside them are midwives, who guide childbirth with a patient-centered approach, often in partnership with OBGYNs and labor nurses. They emphasize natural birth when possible, while also being trained to recognize when medical intervention is needed. Midwives provide emotional support and continuity of care, often building strong relationships with mothers and families throughout pregnancy and delivery. But care isn't just doctors and nurses. Pharmacists ensure medications are safe, effective, and tailored to the patient. They catch dangerous drug interactions, counsel patients on proper use, and not just doses to fit individual needs. Without their oversight, medication errors would be far more common. EMTs and paramedics are the first responders, stabilizing patients and transporting them to hospitals in emergencies. They make life saving decisions in high pressure situations, often long before a doctor ever sees the patient. Social workers and case managers help patients navigate life outside the hospital walls, including insurance, rehabilitation, counseling, and community resources. They ensure patients don't fall through the cracks once they leave the hospital, connecting them with vital support systems. This ties in with Medicare and Medicaid. Medicare is the federal insurance program for people 65 and older, and for some younger people with disabilities. It ensures seniors can access doctors, hospitals, and medications without losing their savings. It also covers essential services such as hospice and rehabilitation that older adults only rely on. States jointly run Medicaid and the federal government. It covers people with low incomes, pregnant women, children, and those with disabilities. For millions of Americans, Medicaid is the only means they have to afford medical care, fill prescriptions, or receive long term care. Without these programs, access to many of the professionals we've talked about wouldn't be possible. At the very top, we find researchers and leaders. Researchers test new treatments, conduct clinical trials, and advance medical knowledge. They're the ones studying whether a new drug works better than the old standard, or whether artificial intelligence can detect disease earlier than the human eye. Their work may not directly impact every patient, but it shapes the therapies, medications, and technologies that define modern healthcare. And then there's the Chief Medical Officer, or CMO. The CMO is the physician executive who sets the medical direction for entire hospitals or systems, ensuring safety, quality, and innovation while keeping patient care at the center. They balance clinical insight with leadership skills, often making the big picture decisions that affect thousands of patients and staff. In many ways, they're the bridge between the science of medicine and the business of healthcare. In closing, from the receptionist at the front desk to the CNA who helps you eat, to the nurse who monitors your care, to the labor nurse guiding childbirth, to the nutritionist shaping your recovery, to the cardiologist, oncologist, neurologist, orthopedic surgeon, psychiatrist, psychologist, pediatrician, OBGYN, surgeon, anesthesiologist, pharmacist, EMT, social worker, and finally the chief medical officer. This is the healthcare system. And behind it all, programs like Medicare and Medicaid ensure that patients can access the care they need. It's not one person, it's a system, a network, a family of professionals working together. Thank you for joining me on this bottom up tour of the medical field. If you enjoyed this episode, please share it with someone curious about what it truly takes to deliver care. And as always, stay tuned for more right here on CyberClinic.